Welcome to the Societe Clinical Skincare webinar on combating stress and skin inflammation. Today we will understand the best ingredients, products, and treatments to repair the skin's barrier function. My name is Phoebe Kraus, and I am a corporate clinical educator for Societe Clinical Skincare. Welcome. Stress has a great impact on our skin, and stress is really defined as any biologically negative force. We felt that this topic was so important and especially relevant to everybody right now. Even if you don't feel stress, we can guarantee that it is having an impact on you. The skin is really subject to both external and internal stressors every single day, and these can be both physical and chemical stressors. We also have psychological insults, such as emotions like fear or anger, which combine with both physical and chemical stress. So we really need to protect our skin from stress and repair the damage that is caused from it. So how stress affects the skin? Well, it's the second leading cause of premature aging. We know that sun exposure is the first. It is the number one cause for rosacea triggers, so it does have a great impact on episodes of rosacea. Stress also suppresses the immune response of the skin, and as we know, the skin is our body's first line of defense and is an integral part of our immune system. Stress can reduce surface antimicrobial peptides, which are really critical for helping to keep the skin in balance. It lengthens wound healing time by up to 30%. Stress affects every element of your skin, from the pores to the dermal proteins and the DNA inside every cell. Stress can also shorten the cellular lifespan, so it can actually create premature senescence or cell death. And really, stress exasperates every skin condition. Now let's talk about how stress hormones impact the skin. There are two main stress hormones, cortisol and epinephrine, which is also known as adrenaline. Now when stress releases the body's level of the hormone cortisol, which, similar to our diet, increases blood sugar levels in the body and results in glycation. Then you have the fight or flight response, which releases adrenaline, which can reduce blood flow, resulting in a dull, tired appearance. Now, at a cellular level, let's talk about how these hormones impact the skin. Well, of course, they create inflammation. They also cause damage to the cell membranes, the telomeres, and the DNA, which are what really protect your skin's integrity. Stress can cause cellular death of vital skin cells such as keratinocytes, fibroblasts, and immune cells. And they can also create an overproduction of MMP enzymes, which are known as the matrix metalloproteinase enzymes. And these are the enzymes that we tend to have an overabundance of in our skin. And what they can do is they can break down essential proteins like collagen, elastin, and hyaluronic acid. Now let's talk about the visible effects of stress, because we know that stress accelerates aging, and there really is no better example of chronic stress than that of a presidency. So in the graphics on the right, you see an official going into office, and then over the course of that 8-year term, it is clear that due to the overwhelming amount of stress, there is a very visible effect on their appearance. Long bouts of chronic stress can actually speed up aging by 6 years, and this is more commonly seen in women than men. 85% of the aging that we see in our skin comes from external factors, and this is also known as extrinsic aging. Now, stress is one of those components, but the others are sun exposure, pollution or ozone, and an unhealthy lifestyle such as diet, alcohol, or smoking. Now we're going to start to talk about a barrier disconnect, also known as a non-intact barrier. And really, skin diseases are caused by a combination of a barrier disruption and chronic inflammation. So just to give you some examples of how they manifest in the skin, extrinsic aging from UV exposure, stress, and environmental pollutants causes our skin to age prematurely. It is characterized by thicker, leathery, textured skin, so you see kind of this coarsening of the skin, deep wrinkling, and furrowing are much more prevalent. We see irregular skin pigmentation in the form of hyperpigmentation and age spots. And then we also start to see these actinic keratosis, which are an overgrowth of the skin layers from extended periods of sun exposure. Patients with skin conditions like acne, rosacea, and sensitive are all dealing with inflammation and an impaired barrier and are often exasperated when under stress. Dermatitis is a general term for skin inflammation, and it's often caused by an irritant, which causes itching and a skin rash. And lastly, we have keratosis pilaris, which are the fine, bumpy textures on the upper arms and thigh or elsewhere on the body. So let's talk about the purpose of the skin's barrier function. The stratum corneum, as we know, is the outermost layer of the epidermis, and its purpose is to protect us. This barrier is only 1/16 of a millimeter, which is about 25 to 30 rows of flat, dead skin cells that are filled with keratin, and these are continuously being shed and replaced. The skin's barrier function affects both the aesthetic and the physiological functions of the skin. The chief barrier function takes place between the intracellular spaces that are appearing as brick and mortar. What this dense structure of cells and lipids creates is a very highly impermeable matrix of cells, and this prevents water loss and invasion of foreign substances such as bacteria and other injuring materials. Now, if there's any damage or reduction in these major lipids and proteins in our skin, then we are definitely more susceptible to dehydration, loss of firmness, and we begin to lose a lot of the moisture in our skin. So if they are in any way removed or depleted, the skin can become very dry and prone to reactivity or sensitivity. So just to give you a good visual here of the difference between a healthy skin barrier and an unhealthy skin barrier. So what to expect with a non-intact barrier is inflamed or sensitized skin from loss of water, nutrients, and the accumulation of toxins, allergens, and bacteria. Signs of an impaired barrier become very noticeable on the skin's surface in the form of flaking, irritation, dryness, and stinging. So if the skin's barrier is not intact, really very little protection exists. So in a healthy skin barrier, we see here that the epidermis is nice and intact. It's keeping out those elements and those toxins, and it's maintaining internally the water and nutrients that it needs to function. On the other hand, we see a non-intact barrier, which has almost like these little tears or openings in the stratum corneum in which different allergens and bacteria can enter into the skin. And at the same time, we're losing our water and nutrients that our skin very much needs. So it's kind of this vicious cycle here, as you can see. So what causes a barrier disruption? On a cellular level, a barrier disruption is caused by damage of the major lipids and proteins in the stratum corneum. So this is the increased transepidermal water loss and the loss of our natural moisturizing factors, our lipids. One of the best examples of a non-intact barrier is our dry hands. Many of us right now are overwashing our hands in effort to be sanitary, and this disrupts the skin's barrier and causes the irritation, cracking, and redness. So there are several different environmental insults that can cause a barrier disruption. The first being severe emotional or physical stress. If you are experiencing a heightened period of stress, this can absolutely have an impact on your skin and exacerbate any issues you were already dealing with. A hormonal disruption or menopause can change and affect the skin's lipid secretions within the cell matrix. It has been reported that within 1 year after menopause, the dramatic aging that is seen in the skin is really due to the lack of estrogens that help to defend against inflammation. Also, high testosterone, which we know is connected to androgens and acne. A very common cause of a barrier disruption is from aggressive or improper daily skincare. So many chemicals in products can cause a disruption in the skin barrier, especially an ingredient sodium lauryl sulfate, which is often found in cleansers. It is not in either of our professional cleansers. And then propylene glycol, which is also a known skin irritant. Different allergen exposures, so things like heavy metals, can also cause a reaction to the barrier disruption. One of the most common examples is that of contact dermatitis. Lastly, different environmental conditions. So this could be a repeat exposure to very dry or very humid conditions. And then radiation, of course, in the form of UVA, UVB, HEV, and X-ray. So when we talk about barrier repair and barrier protection, it's very different than hydrating and moisturizing. So generally speaking, hydrating products really just increase water concentration to the skin. So they help to attract moisture, but they don't actually repair the barrier. Moisturizing ingredients, which are designed to make the external layers of the skin more soft and pliable by also helping to increase hydration. But barrier repair and protection is very different. What's necessary is to prevent transepidermal water loss and create protection from different environmental assaults. And the 3 products in our range that really help to do that are our Transforming Skin Complex, Clarity Back Complex, and Vitamin D Complex, because they actually help to put an invisible barrier on the skin, almost like a Band-Aid, to help to keep the skin protected throughout the day. We will begin to focus on the Societe products and ingredients that help with barrier repair, and these are very sophisticated ingredients that prevent water from evaporating from the skin and provide an effective barrier. Tocopherol acetate, also known as vitamin E, can be found in our Transforming Skin Complex, Pure Everyday Cleanser, and Clarity Back Complex. Vitamin E is a fat-soluble antioxidant that has moisture retention properties and really helps to smooth the skin's surface. It also protects against ultraviolet light, pollution, drugs, and other elements that produce cell damage like free radicals. Vitamin E maintains the skin's oil balance while cleansing, which is really important for the barrier function. It also helps to reduce transepidermal water loss. I want to quickly review our conditioning prep solution because it really is an excellent anti-inflammatory to treat the skin if the barrier is not intact. It helps to immediately calm and soothe the skin, especially if you're suffering from anything like a sunburn or an itch from a heat rash, bug bites, or poison ivy or oak. This conditioning prep solution will immediately take that sting out. It also has great anti-glycation benefits. So as we know, glycation can be a result of stress aging, and so the ingredients resveratrol and L-carnosine help to combat against it. This can be used in the treatment room before or after waxing, during facials, and we recommend storing it in the refrigerator for an extra cooling sensation. It is available in our back bar size. Later in this presentation, we are going to be reviewing a protocol that can be used on skin conditions with a non-intact barrier, and the conditioning prep solution is part of that protocol, so we'll give you a great idea for how to implement it in the treatment room. Another really important repair ingredient is panthenol, which is also provitamin B5. This is a water soluble, stable, and very low molecular weight vitamin. It helps to aid in tissue repair. It is non irritating, non sensitizing, and has great moisturizing and conditioning benefits. Deficiency of vitamin B5 can result in many dermatological disorders, and there is considerable data about its use for helping with wound healing. It is a very quick, deep penetrating moisturizer. It also stimulates fibroblast proliferation and aids in tissue repair. This ingredient does also help to prevent transepidermal water loss. It deeply hydrates the stratum corneum and is a very, very effective anti-inflammatory. Next, we have shea butter, which can be found in our Transforming Skin Complex and our Calming Relief Balm. It is a natural moisturizer that has amazing benefits, including natural sun protection. It's excellent for anti-aging, anti-inflammatory, soothing, healing, and has moisture properties. It helps to even the skin tone and returns the healthy luster in the skin. And this ingredient is naturally rich in vitamins A, E, and F, which are really essential for good skin balance. Both the Transforming Complex and the Calming Relief Balm can be found in our recovery kit for post-care, which is something that we'll discuss later. One of the most exciting barrier repair ingredients is our brand new vitamin D, which is called cholecalciferol. And this is a fat-soluble vitamin that has antioxidant, vitamin, and MMPI properties. It helps to regulate many physiological processes in the skin, including cell growth and repair. Now, research shows that topical vitamin D is excellent for dermatological conditions like dermatitis, eczema, psoriasis, and rosacea. And really, you get an added protection for your skin when using a topical vitamin D because it combats against oxidative stress, free radicals, and is highly anti-inflammatory. Some of the benefits for the skin is that it mobilizes the immune system, so it helps to attract immune cells and enhances the protective and rejuvenating effect of the skin. And its healing and repair capabilities are also very beneficial. So they help to control the microbial flora and keep the skin in balance. It promotes epithelial repair and supports angiogenesis, which is increased blood flow to the surface. The next barrier repair ingredient is niacinamide, also known as vitamin B3. This can be found in our Transforming Skin Complex and our eye peptide gel masks. Niacinamide is a water-soluble form of vitamin B3. It helps to reduce transepidermal water loss by creating an occlusive, natural moisturizer on the skin, really helping to trap in moisture. It has excellent anti-aging and anti-inflammatory benefits. It's very soothing and healing. It also stimulates the production of the skin's natural lipids. And remember, the lipids that we naturally create in our skin are what help to hold or bind moisture and are responsible for hydration, epidermal firmness, and smoothness. And they really help to prevent transepidermal water loss. Let's talk a little bit about stem cells because stem cells are capable of repairing every type of cell in the body. And as we age, the stem cells that we have become less numerous. Now let's talk about rhododendron leaf cell culture extract. This is a very unique stem cell that actually comes from alpine rose leaves, and it helps to enhance the skin's barrier. So it actually preserves the activity of epidermal stem cells and protects them from environmental stress. So remember that our skin protects our body from the environment, and in order to perform this barrier function, the epidermis is constantly renewed and repaired by the epidermal stem cells. So think of your stem cells as fertilizer. We're using them to help to grow, just like we would in a garden, to nourish and help to stimulate our body's own natural stem cells. It's important to remember that we do not use any added growth factors in our products. One of the most amazing barrier repair ingredients in our range is sea whip extract, and this can be found in our Calming Relief Balm. This is a natural anti-inflammatory ingredient that is actually extracted from a marine organism. And this is a very renewable resource that's actually harvested from the Caribbean Sea. And the primary purpose of sea whip extract is that it acts as an anti-inflammatory, and it really works better at disrupting that inflammation cascade than any other anti-inflammatory. And it really is amazing how this product instantly helps to calm and relieve any irritation or stinging from the skin. It's excellent immediate post-procedure, and it's also great for other areas of the body like dry hands. Physical sunscreens are really, really critical for helping to protect the skin's barrier. Now, in both of our sunscreens, Prime and Defend and Cover Shield, we utilize zinc oxide, titanium dioxide, and green tea. Physical sunscreen is truly the most important product for all skin types, especially oily, rosacea, and sensitive skin. There are natural anti-inflammatory properties in these ingredients that really help to provide the best protection. You can think of physical sunscreens like applying 1,000 mirrors to your skin. We're actually helping to reflect away those UVA, UVB rays, and this actually helps to keep the skin very cool. So not only is it protecting you from the sun, but it's helping to keep the skin cool and prevent inflammation. It also helps to keep out environmental pollutants and fight free radicals. These sunscreens also help to prevent irritation, redness, and flare-ups. Skin recovery is really critical, and that's why we created our Recovery Post-Procedure Kit. It contains 1 Pure Everyday Cleanser, 1 Calming Relief Balm, Transforming Complex, and Prime and Defend. Now, in young skin, rapid recovery usually occurs within 12 hours, and this is really because in young skin, there's an abundance of stem cells that can help to quickly heal and repair the skin. But as we know, with age, our stem cells become less numerous, and so our body really relies on the immune response and inflammatory signals for healing. So proper product selection post-treatment is really, really critical. And this is especially important for elderly patients or those patients who are stressed or anyone with an impaired skin condition like acne or rosacea. Recovery can take longer. I want to quickly talk about sensitive skin because many people claim that they have sensitive skin, but really sensitivity is a condition that can really occur in any skin type. A true sensitive skin or highly reactive skin type is genetically predisposed. So this would be somebody that has some sort of systemic disorder whereby their lipid barrier is not functioning properly. It can also be caused by something sensitizing, either a topical sensitivity or something orally. And a couple examples of that are either a laser resurfacing procedure. This would absolutely cause a sensitized or highly reactive skin barrier, or a medication like chemotherapy. Now, a great question to ask is if somebody is experiencing sensitivity, ask if they have a burning sensation, because if a patient's experiencing burning, it's likely that it's because the skin is overexfoliated. Now, sensitive patients should always read a product's ingredient list entirely, and they should also avoid sun exposure and conditions that may cause more inflammation or irritation in the skin. Just to review some indications of a sensitive skin type, their skin becomes temporarily red with a touch or application of a skincare product. It's pink to red in color and has this clear, smooth looking appearance. Sometimes there is actually more of like a parchment look or feel to the skin. Sensitive skin is typically very thin and it flushes easily. It may actually feel uncomfortable or painful to the touch, and it is very much aggravated by topical substances and environmental conditions. I wanted to share these before and after pictures with you of a patient who had very hypersensitive and reactive skin. And this was actually due to over the counter products that had different chemicals and inflammatory ingredients that really left her skin very flared up. Now, her result was strictly from Societe Home Care products. She received no in clinic treatments, and it's safe to say that Society products definitely changed her life. She was using Pure Everyday Cleanser, Calming Relief Balm with Transforming Complex on top of it. Her sunscreen was Prime and Defend. She was using Superfruit enzymes gently for an exfoliation as a weekly treatment, and then the rejuvenating peptide gel masks. And as you can see, her skin is much more calm, much more smooth, and looks very, very happy. And this is a picture of the other side of her face. It's important to distinguish between a sensitive skin type or an allergic reaction because they can often be confused for one another. Now, as we discussed, a sensitive skin type is genetically predisposed or it has been sensitized by something like a treatment or a medication. But really, anyone can be allergic to anything, and allergic reactions can occur in all skin types. And they are typically due to a specific cause, like a sensitizing ingredient, typically a fragrance, a preservative, or some sort of active ingredient can cause this reaction. In the event that somebody is experiencing an allergic reaction, we recommend referring to our skin first aid protocol. Just to quickly review, this is in your training manual and on our university site. In the event that a potential complication arises, maybe like a skin irritation or overpeeling, we recommend applying the following care. In the morning, you would cleanse with Pure Everyday Cleanser, followed by the application of Calming Relief Balm and Prime and Defend. We would recommend doing a rejuvenating peptide gel mask once a day or using ice or a cool compress to help to reduce inflammation in the skin. In the evening, the exact same protocol would be followed without the sunscreen. So let's talk about some treatment options in the clinic. A more mild approach for sensitive or reactive skin types would be a peel wash. So let's say you have a client that comes in, maybe they're new, maybe they're somebody that hasn't been in a while, and you can sense that there's a little bit of that sensitivity in their skin. They have some inflammation, and let's say they've been using just some very generic over-the-counter products that could potentially have some harmful chemicals in them. Doing a peel wash would be a more gentle approach for their skin because what it does is it actually buffers the peel with water. So the steps are as follows. Using a water dampened soft gauze pad, apply a small amount of the acai berry 15% lactic peel onto the pad, and then work the peel solution into the pad by gently rubbing the pad together. Apply to the skin with a very light, quick application, and then after 2 to 3 minutes, remove with water dampened gauze. Another great peel treatment option would be with our pre-peel booster. Remember, the pre-peel booster is a lipid-based peel, and it's actually formulated for more sensitive skin types because it does not disrupt the stratum corneum. The pre-peel booster actually works from the inside out, so once those actives are absorbed by the skin, they begin to work internally. A great treatment alternative would be our sun repair treatment, and this really helps to offer relief from a sunburn, but it would also be great to help to speed up the healing process or to help treat somebody who is experiencing extreme skin sensitivity. We will begin to review this protocol and then show a video demonstration of how to perform it. It can also be performed on other areas of the body. So you'll begin by applying an even coating of the Pure Everyday Cleanser onto the skin and allow it to sit for 3 to 5 minutes to really penetrate. Then using your soft gauze or your fingertips, you'll activate the cleanser using a light pressure with tepid water and then remove the cleanser. Step 3, you will just dry the fan so it's nice and dry to the touch. You will then open 3 4x4 new gauze and saturate them with the conditioning prep solution. You're going to see here shortly in the video that we actually cut a hole in one of these 4x4s so it fits the nose. You'll apply this compression mask onto the skin, and after about 10 minutes, you'll remove it and again dry the skin with a fan. Apply the peptide gel mask onto the skin and leave it for about 20 to 30 minutes, and then remove it and again dry the skin with a fan. You will then apply your hydrator of choice, either Skin Hydration, Calming Relief Balm, or Transforming Complex, and then you will apply your Prime and Defend or Cover Shield. Thank you so much for attending today's webinar. We hope you learned something new. Remember that keeping current with updated information is the key to success. For more information, give us a call, reach us by email, or visit us online. And until then, we will see you at the next webinar.